everyone. Welcome to my channel. Today we'll be talking about important topic. But first of all, before I begin, have you ever wondered why some ladies, the pregnant ones, when they discover that they are pregnant, and after a while they start feeling bad about it, or they tend to withdraw from friends, or they tend to become behaving abnormal in the context. Have you ever wondered why? Have you ever wondered why or what can trigger that, or what could that be, or what is it called? Welcome to my channel. My name is Nostonia at Medic Talk by Nosti. Please, if it's the first time of you coming across my video, please do well to subscribe and click the share button and share also to everyone in your timeline or on your page so that anybody can benefit from this. Today we'll be talking about prenatal depression. Yes, we've been hearing about postnatal depression, which is otherwise known as PPD. But have you come across the word prenatal depression, or do you think there's anything like prenatal depression? What is prenatal depression? Prenatal depression, it's a depression that occurs to a woman that is pregnant. Like when a lady discovers that she's pregnant before she puts to bed. That is prenatal, before birth. That's before birth depression. This depression is caused or it occurs on women that are pregnant. It can be very long term or even before delivery. And many women out there go through this phase. But sometimes we feel that it's normal, or it's hormonal, or because she's pregnant, or is she the only one that is pregnant. But it's a very strong and very serious condition that sometimes or most time it can lead to medical treatment or admission in hospital. And many women go through this a whole lot. What are the symptoms of prenatal depression? Now, prenatal depression is different from baby blues. Baby blues is just the feeling of anxiety or feeling of uncertainty by a pregnant woman when she discovers that she's pregnant. And, this feeling that, what am I going to do? How will be the outcome? And after a while, it will weigh, or maybe a few weeks, 2 to 3 weeks, it will weigh off. But for prenatal depression, it's not so. This occur for months. It can be there till even delivery. And it's these women, they are prone, they have high risk of getting into postnatal depression after delivery. They are more at risk for postnatal depression if not tackled early. Now, what are the signs of prenatal depression? The woman may start feeling fatigue, unnecessary tiredness, withdrawal from friends, resigning from work. You see a lady that one moment she's working, the next moment she resigns. Why are you resigning? She cannot explain. Moody, mood swing, irritability, getting angry unnecessarily without be able to express to somebody or a close relative or a close friend what is wrong with her. Some of them may have eating disorder, like you might eat too much or you eat less, and weight gain, weight loss, depending. If she eats much, she may she may add more weight. If she doesn't eat at all, withdraw from food, she may lose weight. She may involve into drinking without even minding if the baby is fine or the baby will be okay. Some of these women go to the extent of thinking of harming this baby in utero, like while in the womb. They start thinking of harming this baby because for them, the pregnancy is a challenge. The pregnancy is a stumbling block. The pregnancy is a problem that they are facing. And the only way they can get out of this problem is to get rid of this pregnancy or to do anyhow for this pregnancy to go away. Now, when you find such ladies in this situation, you don't have to blame them for acting that way. You don't have to make them feel more terrible. Sometimes this can be trigger. We have triggers of this prenatal and this depression. It could be the way the family, or maybe a lady is not prepared for the pregnancy. It could be because of an unwanted pregnancy. It's because of the boyfriend denies the pregnancy, or her husband is not ready for the pregnancy, or even she herself is not ready for the pregnancy, or maybe she's expecting a promotion, or she's expecting something good in future and she falls pregnant, or she's been having maybe more of male child and she's pregnant and she's not thinking it's a female child, and probably she has gone to scan and she's told that it's another male child, and it could be vice versa. And also maybe family, friends, especially the partner, making her to feel her body is changing, telling her, oh, why are you looking like this today? Why is your body today like this? You're eating too much. Have you not observed that you're eating too much? Every time you always complain that you're tired, you're tired, you're tired. All those things like that can be triggers, especially for a lady that have been able to map up what she wants and what she wants to achieve, and she discovered that she's pregnant. Sometimes even for women that are prepared and ready to be pregnant and discover that they're pregnant because of changes on their body, because of the hormonal changes that will affect their skin, will affect their body structure, that affect so many parts of their body, and it will now make them start feeling depressed. And they will not want to say it, they will not want to talk about it, because they feel if they express it or tell somebody how they feel, it will make them feel weak. It will make them feel less of a mother. It will make them feel less of a woman. So most time they keep quiet about it. And when they keep quiet about it, over time, because they're not saying it for to get comfort, to get console from their partner or from their friends, they tend to develop into prenatal depression. So at this point in time, when this occurs, they start feeling isolated. They want to be on their own. They just want to stop activities. They withdraw from work. They withdraw from social life. They just be on their own. Sometimes they'll starve themselves because they feel once they starve themselves that the baby will not eat. And once the baby is not eating, the baby will go away or something will happen to the baby. So please, when you meet a pregnant woman or you have a pregnant woman around you and you start observing all these symptoms, you don't think that because it's pregnancy or it's where how will I put it? That is how pregnancy does to women. Or after all, she's the only one that is pregnant. She's not the first person that is pregnant. Even as a husband, and you see that your wife is going through this phase, it's our duty to try to encourage them, to make them know that it's a phase, and after a while they'll be fine. Their body structure, after a while, it will come back. You don't make them feel terrible the more you talk to them. And as a lady, if you know that you find yourself in this fix before and you're able to come out of it, do well to drop your comments on how you went about in the comment section. So the triggers that can trigger this, as I mentioned, it could be promotion of work and you discover that you're pregnant. It could be hormone. Yes, pregnancy hormone can also influence it, affecting our, our system, affecting our brain, the releasing of so many pregnant hormone that can cause changes in our moods and also in our body structure, in our skin. It can also be part of it. Also, risk factors are social, friends, relative, partners, as I mentioned earlier, that maybe your close friend is always making you feel that you're adding weight, making you feel you're eating too much, making you feel, why is your own pregnancy like this? Mine was long ago. Your own is even going down. You get, your own is too down. Mine was not like that. Comparison between one pregnant woman and the other. That isn't right. So please, if you in any way find out or discover or observe any pregnant woman in this situation, it is our duty to talk them out and to make them understand that pregnancy is a very beautiful thing and it's not something to dwell on for a long time to the point of developing into prenatal depression and subsequently which can lead to postnatal depression. And once that happens, it's a problem to the mother, to the baby, and to close friends and even the partner. It's a problem. And once there's a problem around everybody around the baby, it can also cause a very big problem to that child and also to the mom and also to the partner or the husband and friends around. And we don't want this in the society as much as we can. We want a pregnant woman to go through the phase of pregnancy and put to bed in a very conducive environment. And at the end of the day, both mother and child are well and healthy. So please do well to share this video, as I said earlier, and comment on this video if you've ever experienced prenatal depression before, and how were you able to cope? What helped you to cope? How did you go about it? And if you've seen a friend that have gone through this phase, what was your part? What did you do to help such a friend? Thank you very much. See you next time in my subsequent video. Bye.